I am Dr. Praveen Tripathi. I am a consultant psychiatrist and de-addiction specialist. Polycystic ovarian syndrome or polycystic ovarian disease is one of the commonest gynecological disease. As the name itself suggests, in this disease there are multiple cysts in the ovaries of the female. First is that the patients who have PCOS, they have a very high prevalence of psychiatric disorders. The most common being anxiety disorders and depression. Even in those patients who don't have any psychiatric disorder per se, the negative emotions of embarrassment or sadness is very high, to the extent of around 50%. Whenever the stress level increases, the male hormone levels in the patients with PCOS also increases. The most important risk factor is heredity. If the family members, if your mother, your sister, your grandmother had PCOD, the chances that you would have PCOD are higher. Second very important thing is obesity. So it has been found that patients who are obese have more likelihood of having PCOD also. Third, what is known as insulin resistance. Now this insulin resistance is directly related to obesity. If the weight is more, the chances of insulin resistance would also be higher. But it has been found that if a patient has PCOD, she usually has insulin resistance also. PCOD is one of the commonest cause of infertility in the childbearing age in the women. So as I said, PCOD at its base, the basic problem is disturbance of the female hormones. Also, there is higher levels of male hormones, that is testosterone. So all these factors combined result in decreased fertility in a female. If you have any of these symptoms like irregular menses or development of facial hairs in the female or acne which is not going away, don't take it lightly. Meet the gynecologist nearby and seek treatment. It might be PCOD. Remember that PCOD is easily treatable.